In about 30 minutes from now, Maharashtra Chief Minister Uddhav Thackeray will be speaking on the impending lockdown in his state. India Today has scooped the details of what lockdown 2.0 in Maharashtra could be like. SOPs for a 15-day-long lockdown are being readied. The lockdown will come into effect tomorrow and be effective till the 30th of April. A package for economically weaker sections is also being prepared. Unlike last year, both inter and intra-state travel will be allowed. Transport services and food deliveries from restaurants will also be allowed to operate. However, private offices, schools, colleges, gyms, theatres, parks and grounds will be shut. Maharashtra reported 51,751 new cases and 258 deaths in the last 24 hours, taking its active caseload to 5,64,700. Meanwhile, the healthcare system in Maharashtra is crumbling. There are no hospital beds, medical supplies like oxygen cylinders are running low, and doctors and healthcare workers are simply overwhelmed. Here's how the state and its hospitals are coping with this Maha-COVID surge.
Angry relatives of a COVID-19 patient in Mumbai's Nalasopara came to blows with the hospital administration. The relatives created ruckus after the patient died within 3 hours of being brought to the hospital. They allege that the death was due to lack of oxygen and that the hospital did not inform them about the short supply. As Maharashtra battles second COVID surge, hospitals in the state are bursting at its seams. There are no beds, no medicines, no doctors.
The medical facilities, the entire healthcare facilities in the state of Maharashtra and Mumbai have collapsed. They have absolutely gone to ground zero. From taking tests to getting beds in hospitals to getting life-saving drugs to actually scoring ambulances to pick up your parents and drop them across. The whole system is collapsed.
My father got, infected with COVID. We struggled a lot, but there were no beds available at all. We were struggling for almost 4 hours just for an ambulance to, take him to for his final rides. But the driver just gave me an excuse that I have quit the BMC job, and now I am running on my my private ambulance. And if you want me to get this done for you, you have to pay me 7,000 rupees.
In Satara, a COVID patient was administered oxygen in an auto rickshaw outside Vadu's rural hospital because there were no beds available. Currently, there are over 8,000 active cases in the district and hospital beds are all full. These patients at Silver Jubilee Hospital in Baramati are being administered oxygen in the veranda. The overcrowded hospital has run out of beds. With a capacity to treat 92 patients, the hospital is now forced to treat over 192 patients. With hospitals in Maharashtra running out of beds and facilities already stretched, State Guardian Minister blames celebrities for the shortage.
अब इतने बड़े-बड़े स्टार्स लोग, अगर अक्षय कुमार, उसके बाद में हमारे क्रिकेटर जी हो गए, उसके बाद में एक्ट्रेस हो गई, अगर ये लोगों ने जाके अगर बेड्स ऑक्यूपाई करे तो जिनको जरूरत है उनको तो मिलता नहीं है। महानगर पालिका ने निर्देश निकाला है कि उनको जो है वो वार्ड लेवल से आदेश मिलने के बाद ही लिया जाए, लेकिन अभी सेलिब्रिटी हैं, सचिन तेंदुलकर जी हो गए, कैटरीना कैफ जैसे लोग हो गए, तो ये लोग कहीं ना कहीं अपना सोर्स लगा लेते हैं जो ठीक नहीं है।
With the surge only intensifying, the squeeze in hospitals will only get worse. Expect more tensions, if not all-out unrest. Bureau Report, India Today.
For a sense of the preparations across the state of Maharashtra, just ahead of the Chief Minister's address, we're joined in this broadcast by our Maharashtra Bureau Chief Sahil Joshi. With us from Pune is Pankaj Khelkar, which has been amongst the most badly impacted COVID-hit centers. And Pankaj Upadhyay joins us from Mumbai as well. Sahil, to you first. Everyone watching at this time would have just one question. What to expect from tomorrow? What has been happening behind the scenes? And will this potentially set a template for what may happen in other states going forward? where the COVID situation has started to deteriorate. Sahil, what should we expect from tomorrow?
Okay, first things first, Maharashtra already has a night curfew which starts from 8 p.m. in the night. So the night curfew will continue tomorrow. What it looks like now is that the Maharashtra government will add the stricter restrictions from tomorrow night onwards till 30th of April. Now what we are hearing is that the restrictions are going to be just like the way they were in place when there was a complete lockdown in state of Maharashtra as well as in the country. Now what is going to be different this time is going to be that the government has decided that there will not be any ban on the public transports or the transportation, because last time what happened is that the people got stuck wherever they were. Rather than that, the panic, they started panicking about it. So rather than that, the transportation has been allowed, but the rest of the things like the offices, the public gatherings, the malls, the restaurants, and everything else will be shut down. So basically, you will not need to go out for anything else. In fact, only those offices will be working where the essential, those who cater to the essential services. So, and what are the essential services that will be categorized in the SOPs, which will be, come out with the notification just after Chief Minister's address. So, what the Maharashtra government is looking at is to avoid crowding and keep people at home at least till 15 days so that they can get this time to release some pressure from the medical services, which are completely under pressure at this point of time.
Okay.
The beds are full, the oxygen.
Okay, so Pankaj Kelkar, you're in Pune. Pune has been badly impacted. In fact, it's one of the most impacted districts in the country. Give our viewers a sense of how bad the situation in Pune is and the expectations amongst the citizens right before the Chief Minister's address this evening.
So Rahul, over here in Pune, the city is in bad state. The district is also in bad state. Almost 34,000 active patients as of date in Pune. More than 5,500 positive patients on every day. And so the lockdown, a strict lockdown is what everybody is expecting. Now I had a word with one of the cabinet ministers and he said 2 days Herculean meetings, and they are also confused whether to go for a partial lockdown or for a strict lockdown, because both the ways they are being hammered. The opposition is hammering them, but they are of a thought that strict lockdown is what they will be going for. Now with me I have some of the business community of Pune, Kirloskars, other people over here in Pune, what they want to say, what are they expecting. We would like to have a word from them. Yeah, sir, what would you like to say? Government going for strict lockdown or partial lockdown? What do you expect?
First of all, I have a suggestion that this opposition should now cooperate with the government. This is not a time for taking out excuses for who is not doing what doing. So let us support the government and avoid lockdown, because economy will collapse. But we have to observe some strict discipline is not there. You see on the road, even in our society, I see people are not using mask, and even after telling. So discipline is needed, and this is not a time to.
Yeah. So here you have heard, lockdown is what they are not expecting. The community is saying that the economy should not collapse, but strictness should be there, which is not happening on the roads.
Pankaj Upadhyay was in some hospitals through the day, looking at the preparations in these hospitals to deal with the surge. How bad was the situation that you observed, Pankaj? What did the medical staff that you spoke to tell you?
Rahul, the situation on ground zero is pretty grim. Most of the hospitals in Mumbai that we visited are working in full capacity. The doctors say, they've really crossed the saturation point now. They say the doctors are overworked. In fact, Rahul, we've just received the message from the BMC giving today's data, and it says 7,898 new cases and 26 deaths. And now this shows that the numbers in Mumbai are continuously fluctuating. while on the 11th there were nearly 10,000 cases. On 12th there were 6,905. But today the count has again increased. Though the good part is that the death rate is slowly coming down, and today the death count is 26. But seeing the tremendous amount of pressure that is there on the health infrastructure, what the BMC has now decided is that within 5 weeks' time, 4 new jumbo centers are going to be erected in the city. These are going to be in addition to the 6 that we already have. BMC is also planning to create one more jumbo center at the Mahalakshmi racecourse as well. Additionally, many 5-star hotels have also been booked. The cost structuring is being worked out so that the patients who are on the road to recovery in the private hospitals can be shifted to these 5-star hotels as well. Around 250 budget hotels, 2 stars, 3 stars hotels are also in consultation so that they can be accommodated as quarantine centers as well. So the BMC says that definitely there is a crunch. ICU beds are a crunch. Ventilator facility is a crunch. Medical oxygen remains a big concern, and the Chief Minister had said that they need somehow they need a medical oxygen supply, be it from Madhya Pradesh, Karnataka or wherever.
Okay.
So the condition on ground zero remains pretty grim. The other
Pankaj
day,
Upadhyay, thank you for joining us. Thanks also to Pankaj Khelkar and to Sahil Joshi for these updates.